Hi, I hope you are doing great this week, having a great week, and making an impact to your patients in your veterinary dentistry service and also in your practices in general. Last week, we kind of changed gears a little bit. Last week was our 50th episode, so we talked about some performance enhancing basics that actually are not necessarily as much performance enhancing, although they definitely are the tenets of performing. Period. The high performing people in any sport, in any cognitive endeavor, have all those things mined out and are mapped to the very detail that and without that they would not be able to do what they do at the level that they are doing them at. And those are sleep, number one, by far and away the best, nutrition, exercise, and meditation, breathing work. So we're going to touch on the others. We're not going to go into a lot of detail, but I think it warrants some discussion on how these things impact us. So let's first talk about exercise and how exercise helps to enhance the chemical cascade that's responsible for several positive effects on the brain. So we know that when we exercise, we release some positive neurochemicals into the system, and these benefit the brain in multiple ways. So some of those are endorphins. Obviously, that's the one that we associate exercise with, where we get that runner's high, which now appears to be some things other than endorphins, namely the endocannabinoids play a role. So we've got some other research that supports that there's multiple chemicals that are released during exercise, and not only just that period of elation or high that we get at some certain point. Usually for runners, that's about 40 minutes of casual running that is not totally devastating. You can still breathe and talk to someone fairly readily at that level. So that's just an example of when those things start to really kick in. You start to feel them in general. Certainly, that's exacerbated the more intense and the more duration of exercise. But I think that's what you probably are more familiar with, is those endorphins and kephalins. And now, as we know, endocannabinoids and anandamide are big. Dopamine is another that is released during exercise. We don't know exactly. There's not enough research that's done yet. There are multiple research projects underway that are looking at which exercises for how long affect dopamine more specifically and are responsible for the most release of that positive neurochemical. And the reason it's being studied so intensely is because it does so many things, and certainly along with these other neurotransmitters, but dopamine is very impactful for things like regulating heart rate. We already talked about sleep and sleep cycles. Mood, which is huge, because when we're in a bad mood, we are not creative and we're not productive. So good mood is more than we give it credit for, as far as an output potential. Where if we're in a good mood, we become more creative, we become more cognitive, our memory is enhanced, and we're able to make associations better in the brain when we're in a good mood. So dopamine definitely does that. It's also essential for attention and motivation. It enhances working memory and definitely plays a huge role in learning. So all those things, dopamine induced from regular exercise, will help in everything that we just discussed. The other thing that we've known for quite some time is that it promotes neuroplasticity. So when you exercise, you release brain-derived neurotropic factor, which will promote neurotransmitters and signaling factors that will induce neuroplasticity, allowing for learning new skills, activities, languages, you name it. Another huge benefit that is kind of a given: when you're exercising, you're breathing more. It also increases the oxygen supply to the brain, and how can that be bad? It definitely, again, includes or improves things like executive function, which is working memory and creative, flexible thinking, and also gives you better self-control, makes you better able to handle the stress of the day. So exercise in a nutshell, all the positive benefits of that. And we could go on, but those are the main ones, and certainly very, very important. When we look at the next of the list, which is nutrition, I mentioned last episode that nutrition is very personal. A lot of people have their personal approach to nutrition, and certainly there's environmental factors involved there now more than ever. And so there's not as much to discuss with that, although from a general standpoint, from a nutrition standpoint, there are a couple of things that were interesting to me recently, and maybe not so recently. But one of those things is the amount of sugar that we consume is probably the worst thing we can do. Not probably, it is the worst thing that we can do from a nutrition standpoint. And part of that is with the incidence of diabetes in certainly in this country, in the U.S. Huge impact on that, as you know. High sugar intake is terrible for induction of diabetes over time, and we don't always equate sugar to the things that we should equate it to. And this goes back to the not circadian rhythms, but the seasonal change in light and the seasons. So classically, sugar was not consumed except for in the summer, when it was available for a limited time in the form of fruits and berries. It was not something that was consumed after that period of time, mainly fat and meat that was killed and could be utilized during the wintertime. So our access to that is continual. We have access 24/7 to fresh fruits and vegetables, which are packed with sugar, which is not the thing that we want to do, without going into all the physiology, which is super interesting. Just don't have time to do that on this podcast, but just know, and if you're interested in looking into that, look into some of the literature that's out there on the bad effects of sugar. Certainly cancer, and certainly breast cancer in women is highly linked to high sugar levels in the diet. And a lot of those we get unexpectedly when we are consuming fruits and vegetables in quantity all the time throughout the whole year. So be cognizant of that. And that's certainly something that we need to look into a little deeper, maybe on another episode that is in this series. But as far as personal and your loved ones and functioning at a high level and increasing longevity, sugar should be the main thing that we're concerned with in our diets. And that's based on a ton of science over the years. So whole foods obviously are the best versus processed foods. We want to lean toward organic, obviously non-GMO, to avoid all of the extraneous things that can end up in our food. Those basic things you can take and you can research on your own and come up with a plan if you're not really doing any specific plan at this point. And when I say plan, I'm not talking about diet. Dieting is and has been shown to be totally ineffective. If you incorporate a lifestyle change with good nutrition, that should be something that you stick to forever. And combining that with good sleep and exercise, those things also impact weight. If you don't sleep, you're much more prone to weight gain. And that's kind of a surprising thing to me. I didn't realize that was a big factor, but it is a big factor in weight gain. So if we change our nutrition plan, we exercise, and we sleep right, if as long as the quantity is not excessive, then we're in pretty good shape to be in pretty good shape. So we'll go on to the final little segment of those 4 tenets. And that would be breathwork and meditation. And again, I don't feel that it's my place to get into a lot of that. I'm no expert there by any means, but I do practice that every day. And one of the things that you can do that's super simple, that is, again, this is all science-based and backed by high performance researchers and a lot of high performing, and I hate to say coaches because there's coaches for everything out there, but high performing coaches that have been in the situations where they have to have a team that performs at the highest level. So they incorporate all the science into that. And that would be a perfect example of that would be a SEAL team. And the commander of a SEAL team that I listened to recently, whose name escapes me, that is also a research scientist now, does and makes sure that he always has incorporated what we call box breathing into the regimens for his commandos before they go on to a mission. And so it can really ramp up your ability to focus. It can ramp up your ability to not react to things that should not be reacted to. In other words, it helps our stress levels tremendously. And very simply, box breathing is just breathing in for a period of time, holding it, breathing out for a period of time, and holding it. Generally with all the same amount of time, but that can vary considerably. So, for example, box breathing using 5-second inhale, 5-second hold, 5-second exhale, 5-second hold. And then repeating that for 7 to 30, 40 times will definitely help calm you down in a situation where you're about to go into something that is very important to you, a meeting or interaction with a colleague that you've not been looking for, something along those lines. It decreases your reactivity, makes you more calm, increases your focus, and definitely increases that brain oxygenation that we talked about earlier. So that's one thing that you can do. You can also do a really quick exercise that a lot of people use for short-term stress relief. You're about to have an interaction with a colleague, and you want to be at your best, but it's stressing you out. You can inhale, deep inhale. So I'll do this with you to kind of simulate it, but it's a deep inhale. And then once you get to that inhale, using your diaphragm, where you're pushing out your abdomen to expand your diaphragm and your lungs consequently, and then using that and your lungs to increase that capacity once you reach that peak of that sharp inhale, waiting a second and then inhaling even more, and then letting that out slowly over a period of time. So let me demonstrate that. So the inhale, the hold, or the inhale, the extra inhale, and then the exhale. So something like so the extra exhale is the extra time in exhale, and the slow exhale is increasing your parasympathetic nervous activity. It's influencing the vagus nerve, and it's helping to calm you down. So as few as 3 of those back to back, if you utilize that, you will notice that it changes the way you react, the focus, and you'll have much more positive outcomes with that type of breathing, and make it so that you can go into those situations and be more confident and be more calm. So I hope those help. Those are all things that I find really interesting, that I feel that we as veterinarians and technicians don't get that much exposure to. I'm super interested in living a healthy, long lifestyle. I don't want to be, I want to live to be 120, but I don't want to live to be 120 in a wheelchair or debilitated. I want to live a healthy life up to the point where I can't live that healthy life anymore. And that's what these things will help you do. And again, this is not just hearsay. This is science that we're finding more and more about every day. NAD plus is one example of a compound that's coming up, and is one that we probably will be taking for longevity. Metformin's another one where there's a lot of research going on, which is used for diabetic regulation right now and has been for years. Some of the adjunct things that have a lot of research that is being conducted right now will help us, but nothing can help us as much as these 4 things that we've talked about in setting the stage for living a healthy life and coming to work and coming to life every day, being at your best. So if you enjoyed this, please share it with a colleague, share it with your loved ones. And I hope that you have a chance to institute some of these things. Let us know how you feel after you have, and if you need any help along those lines, there's plenty of resources online with searches that can put you in the right direction. So hopefully you've enjoyed this. We wish you a tremendous week and weekend, and we'll talk to you next week. Take care.